So hello and welcome back to my channel. Today I am going to discuss regarding a very common complaint, regarding a very common presentation with which the ENT patients come to our OPDs as well as in emergencies sometimes. So which is nothing but the otalgia. Otalgia is the same as that of the ear pain in medical terminology. So without any further delay, let's dive deep into the complexities of otalgia and outline the approach to manage and to find out the cause of otalgia. Thank you. Without any further delay, let's start it. So we will be starting the point with first definition. Otalgia is the pain in and around the ear. What I mean to say is that the ear pain is not only because of some local causes. That means the cause of the pathology may be within the ear, but it may also be referred from any other area in the head and neck. Correct? So this pain in the ear can be inside the ear, can be because of the pathology within the ear, or the pain in the ear may be failed because of some pain originating from some other areas which is getting radiated to the ear. So it can be around the ear also. So the pain in and around the ear, the whole thing is collectively known as otalgia. Correct? So now thus the otalgia can be divided into two types, primary and secondary. Let us start with the primary and secondary otalgia. The secondary otalgia can also be known as the referred otalgia because the pain is getting radiating from somewhere else. So let us jump into the definitions of each category. Otalgia is the pain in the ear caused by some ear pathologies only. Now, these ear pathologies can be inflammatory pathologies. Secondly, they can be traumatic pathologies. Even these can be neoplastic pathologies. Okay, but the pathology is within the ear only. Correct? That is primary otalgia. Whereas secondary otalgia, here the pain in and around the ear is actually referred from the head and neck regions which are innervated by the nerves which supply also to the ear. So the main funda is within the nerve supply of the ear. Correct? So if the same nerve supplying some other organ, and that organ is inflamed. Might be tonsils, might be pharynx, might be even dental causes, might even be because of some tongue pathologies. Whatever may be the cause, whatever may be the organ involved by the primary pathology, if the same nerve has some supply to the ear, then along with the primary organ pain, there will also be a referred ear pain. Correct? So now we will be discussing about the nerve supply of the ear. Correct? From external ear to middle ear, we will be discussing it all. Correct? The parts which can be involved in both primary as well as referred otalgia. The nerves relevant to this very part will be discussed in the next part. Correct? Let us start with the external ear. The branches of the nerves supplying the ear which are relevant to us. Correct? Firstly, it is the glossopharyngeal. Clear? So, glossopharyngeal nerve supplies the pharynx, the tonsils, as well as some part of the tongue, that is actually the posterior one third of the tongue, of the base of the tongue, and it also supplies along with them the middle ear and the medial surface of the tympanic membrane, as well as the mastoidea cells. Clear? So that is being only demonstrated over there. So this is the nerve. Okay, which supplies the tonsils, the posterior tongue, middle ear, medial surface of the tympanic nerve membrane, sorry, and the mastoidea cells. So that is the about the cranial nerve 9. Next, let us come to the next nerve after 9th. It is the 10th cranial nerve, and this 10th cranial nerve is actually supplying the external auditory canal. Some parts I will be discussing, the tympanic membrane, even the pharynx, larynx, and the concha, outer concha, okay, in the lateral surface. So you see, this is the nerve supplying the pharynx, larynx, lateral surface of the tympanic membrane, external auditory canal, and the concha. So that is about the 10th cranial nerve. Next, now there are another two cranial nerves. One is the nerve, facial nerve, and the another is the fifth cranial nerve. So the one branch of the facial nerve, that is the sensory division of the facial nerve, also known as the nervus intermedius, is supplying some parts of the external auditory canal, again some part of the lateral surface of the tympanic membrane, as well as the concha. Correct? So the 7th cranial nerve supplies the lateral surface of tympanic membrane, external auditory canal, and the concha. So that is about the 7th cranial nerve. Of the, to be specific about the part, it is the nervus intermedius. So this is the nervus intermedius. Clear? Next, there is the cranial nerve 5, which comes along the neck like this, and having a branch, that is the mandibular division. Okay, and from the mandibular division there is another branch, that is the auriculotemporal nerve, which has some supply in the ear. Okay, so the supply is firstly the lateral surface of the tympanic membrane, the external auditory canal, the temporal scalp, the preauricular area and tragus, as well as the temporomandibular joint. So the cranial nerve 5 supplies all of them. Now, from the cervical plexus, two nerves actually help in relay sensation to the ear again. Okay, they have also some divisions. From C1, C2, sorry, from C2, C3, that is greater auricular and the lesser occipital nerves. Clear? So the greater auricular nerve supplies the angle of jaw, majority of pinna, lateral neck, and the skin over the parotid gland in the mastoid process. So that is about the C2, C3, greater auricular nerve. Clear? So this is the greater auricular nerve going to supply the angle of the jaw, the majority of the pinna on its outer aspect, and the lateral neck, then skin over the parotid gland and the mastoid process. Correct? Now, coming to the lesser occipital nerve, which is again derived out of the C2, C3 divisions of the cervical plexus only. So this is again C2, C3, and that is lesser occipital nerve. This is supplying the posterolateral scalp, superior pinna, and the supraauricular scalp. So this is the part supplying the posterolateral scalp, then superior part of the pinna, as well as the supraauricular scalp. In the portion of the external auditory canal, the anterosuperior quadrant is being supplied by the V3, that is the part of mandibular division of the trigeminal nerve, that is nothing but the auriculotemporal branch. And the anteroinferior quadrant is being supplied by the auricular branch of the 10th nerve, also known as the Arnold's nerve. The posterior inferior quadrant is being supplied by the C2, C3, that is, sorry, C2, C3, that is the greater auricular nerve. Okay, and the posterior superior quadrant supplied by the 7th nerve, that is the sensory division of the facial nerve, that is nothing but the nervous activities. Now, tympanic membrane again is being supplied by these two. One, it is the 10th nerve, that is the Arnold's nerve, supplying the part of the lateral surface of the tympanic membrane, the posterolateral part, and the auriculotemporal nerve again supplying the anterior part of the tympanic membrane lateral surface. Correct? So now you can well see again the auriculotemporal nerve supplying the anterior part as well as the superior part, the inferior quadrant in the posterior quadrant being supplied by the vagus nerve, Arnold's nerve. Also some portions from the facial nerve, auricular division, and the glossopharyngeal nerve, that is Jacobson's nerve. But obviously the Jacobson's nerve, that is the Jacobson's branch of the glossopharyngeal nerve, supplies mainly the medial surface of the tympanic membrane. So medial surface, tympanic plexus derived out of the glossopharyngeal nerve only, and the facial by the chorda tympani nerve also supplies some supply of facial nerve is also there. Correct? So I think this will be sufficient to know that any pathology or in rather any organ being supplied by these same nerves, that is 7th, 9th, the 10th, the 5th, mainly the mandibular division of the 5th nerve, as well as the cervical plexus, it is being is actually being inflamed or is in pain, then that pain may again radiate to the ear. Correct? So let us now start with the causes of otalgia. So causes of otalgia, again we do know that it is primary and secondary. So primary causes of otalgia means the local causes of otalgia, and the referred causes of otalgia will be different. Correct? That means the secondary otalgia will be different. Okay, let us start with that. First, the local causes. Ear is being divided into three parts: external ear, the middle ear, and the inner ear. Correct? So, any cause of inflammation or pathology in the external ear, which may lead to pain, as well as in the middle ear, which may lead to pain. Even some causes intracranially, because of some complications due to some middle ear disease, may also lead to earache. Correct? So let us jot it down in point manner, bullet manner. Firstly, the causes from external ear. So external ear again can be classified into inner and the external auditory canal. So pinna, perichondritis, then perichondrial abscess, skin lesions like even folliculitis, even some trauma to the ear, and thus there may be development of perichondrial hematoma, so which also may cause ear ache. So each and every cause like inflammation, like neoplasms, even like any swellings or traumatic causes may cause pain in the pinna, which may be felt as which is felt as a ear ache. Correct? Now coming to the part of the EAC. Laryngeal folliculitis. Otitis externa. Then you have got it, no doubt in that. Trauma, foreign bodies, clear. As well as there are some causes like impacted wax, then you have also got it that the eczematous otitis externa, anything otitis externa, correct? Like meningitis, and mainly if there is meningitis bullosa or granulosa. In otitis externa only, there is something like malignant and benign necrotizing otitis externa. Okay. Now, along with them, also something like herpes zoster, also known as Ramsay Hunt syndrome. Clear? So this may also cause something like pain in the ear, correct? And very importantly, any malignancy in the extraordinary canal can also cause pain in the ear. Now, coming to the point of the causes from middle ear. Okay, middle ear causes are firstly, no doubt in that acute otitis media. But here there is a catch. And what's that? Pain in acute otitis media is decreased when discharge starts. Okay. So this is a typical finding of acute otitis media pain only. Clear? Now, the causes of eustachian tube obstruction. Clear? Then the cholesteatoma. Clear? Then now mastoiditis. In eustachian tube obstruction segment, OME, and thus by chance barotrauma is also included. Clear? Then, no doubt in that malignancy of middle ear may also cause pain in the ear. Now, next coming to, I had said you that some intracranial complications of otitis media may also lead to the development of some disease, some pain in the ear. And the only example of that is nothing but the extradural abscess. Obviously, this will lead to headache, no doubt in that. So there will be associated headache along with the development of ear pain. But no other subdural abscess, even epidural abscess, anything, subdural or intracranial abscess being resulted from the otitis media lead to earache. It is mostly associated with extradural abscess only. Okay. So today I will conclude in here only with the nerve supply of the ear and the causes of primary otalgia. In the next class, I will be discussing regarding the part of the causes of secondary otalgia or deferred otalgia, along with some history taking part in a patient with otalgia. So, thank you very much for your kind listening.